Oh, prior to the earthquake, College Arena, as it's called, is rated as one of the best schools in Port-au-Prince, not just by the Salvation Army, by the government. Our students have a great graduation rate and levels, and they do very well. About 1,500 students in the school before the quake. The earthquake didn't devastate the school. Two buildings were destroyed and will have to be replaced. But because school's not in session and can't be in session until the government allows it to be, so we've converted that into a clinic. And can I say, I think it's the finest clinic going in Haiti right now. We've had some amazing doctors and nurses and volunteer staff coming in there who are seeing hundreds of patients every day. And in the early days, they were doing things in that little makeshift operating room that big hospitals wouldn't attempt. And the courage of the doctors and the nurses and the dedication of those people. Lieutenant Colonel Herb Rader is one of them, sort of my hero when it comes to the doctor scene. And coming here, a man who's been retired for a few years and has served around the world for the Salvation Army, came here, performed hundreds of surgeries, and was teaching other young surgeons and doctors and students who were. It was an amazing experience to watch and frankly to be very proud of, to know that people were coming in with limbs amputated, limbs that needed to be amputated, with broken everything, with severe head wounds, with babies that were malnourished, and the man who was buried for 28 days in the debris was brought to that clinic, and he was in our neighborhood, not very far from there, and they brought him there where they got him hydrated and got him on some IV and got him started to eat a little bit, and then transported him to another hospital.
Well, the clinic opens around 8:30 in the morning, but people, because of the large amount of people that we see day after day, people actually come from about 6 o'clock in the morning and they get the numbers, and then they go through the usual triage system where they do the registration, and then they take the weight, they check the pressure, and then they are assigned to whether they're going to see doctors. So then also after that, if they need prescriptions, they go to the pharmacy and they receive their prescriptions and they go along happily. One of the good things that we can look at, in spite of the earthquake and in spite of all the deaths and loss that have occurred, have been a chance for new life, a ray of hope, we should say. And we have had now to date 11 new births. In fact, one lady came last week while the clinic was closed, and we helped her to deliver the baby right here. And she came to the clinic right afterwards, and she and the baby are doing well. We just yesterday had another birth of another child. So we are happy about this. In the midst of destruction, in the midst of trouble, in the midst of despair, we can still be happy and we can still have a positive focus for the future with the new life.
I think I'm amazed at everything the Salvation Army does, since I didn't know anything other than my mother gave clothes and people rang bills. But just to find out there's tens of thousands of people that work with the Salvation Army, I've been nothing but impressed with everything. Well, I've been extremely impressed with everybody that I've run into in the Salvation Army. I mean, it's just an amazing group of people that I didn't know.
I've come to help wherever I can jump in. I have enough experience in family practice and surgery and obstetrics in Zimbabwe that I can be flexible enough to do whatever I'm asked to do. But I would also like to be able to get enough of an idea of what's happening here to assist IHQ, to assist anyone who asks me about what Haiti can do in the long term. Do we need medical people here? Do we need nursing professionals? Is there a need for a clinic? Are we, in the long term, are we going to keep supporting 20,000 people in a camp situation? Or do we look at the long-term goals for supporting the Salvation Army's work here? It's been going on. What can we do to get it back on track again, and how can we continue to support? Because the acute phase is over. Expect to rescue anyone from the rubble anymore. So what can we do in the long term to improve Haiti in its whole entirety? And that means first importance to me even with medicine in the background, first importance is water and sanitation, education, primary care, that's immunizations. That means you need electricity for vaccines, so you need an infrastructure built up in the long term, and you need to be able to support that.